Thank you for tuning into NorthPoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. We're once again joined by two NorthPoint providers, Dr. Carrie Nedrud, who is a pediatrician from Arizona. She did medical school at the University of Arizona and a pediatric residency at the University of Colorado. Dr. Nedrud loves working with children of all ages, from newborns all the way through teenagers and adults. And some of her special interests include speaking Spanish, providing comprehensive, equitable care for all children, helping breastfeeding moms and babies, providing primary care for premature infants, and working with teens on their mental and sexual health concerns. She's moved to Minnesota to be close to family and is thrilled to be part of the team at NorthPoint. We're also joined by Kathy Kreitzer. Kathy is a pediatric nurse practitioner. She did her training at the University of Wisconsin-Madison. Kathy loves working with families, especially following them from newborn through adolescence. And she moved to Minneapolis in 1994 and worked at what was previously called Pilot City and now NorthPoint today. She learned something from her patients every day and has enjoyed watching the clinic and staff grow and learn together. So welcome back, Dr. Carrie Nedrud and Kathy Kreitzer. We're here to talk about a specific kind of immunization. We're here to talk about the flu vaccine. So thank you again for your time and being willing to talk to us.
Yeah, thank you so much for having us.
Absolutely. All right, so let's jump right in and talk about the flu vaccine. So why should someone consider getting the flu vaccine?
Yeah, I think that question is answered partly in what the flu is. So flu is a virus that causes infection of your trachea, your windpipe, and your breathing tubes. It causes high fever, can cause cough and trouble breathing, severe muscle aches, things like that. So it's not, when some people think of the stomach flu, that's not actually what we're talking about. We're not talking about a vomiting illness. We're talking about this respiratory illness. And up until COVID, the flu was actually the leading cause of death of vaccine preventable illnesses in the US. So every year, 200,000 people get the flu, and thousands to 10,000 die every single year of the flu in the US. And so it's more serious than people think. They think, oh, it's just a mild cold and I'll be fine. But there are many people for whom it's not fine. And then the side effects from the flu vaccine are usually mild, things like discomfort at the site, potentially some body aches or a fever. And so just taking those into account, the risks versus the benefits, your benefits are high and your risks are low. And so I do think I would recommend the flu vaccine for everyone over the age of 6 months old.
Awesome, thank you. So tell us about how the flu vaccine is developed and why it changes every year.
Okay, sure. Unlike most vaccines, which contain the most common strains of the pathogen, if more than one exists, usually just one, but they are rarely changed. But the seasonal flu vaccine changes frequently, although, and that's because the virus that's circulating changes. Sometimes year to year, sometimes it stays the same, but health experts really study that and follow which strains are most likely to be circulating in the coming year, and then develop the vaccine based on those strains.
Okay, thank you. And how effective is it, the flu vaccine?
I think effectiveness varies from year to year. They're studied by the CDC, and results are always released to the public. Some large studies from before COVID showed that getting the flu vaccine on average decreases your likelihood of getting the flu by more than half, and it decreases the risk of hospitalization if you do get the flu by 30%. So some people feel frustrated because they feel like they got the flu from the flu vaccine. But again, if you get the killed virus vaccine, you can't get the flu from it. With the live vaccine, you might get mild symptoms from that weakened pathogen that's in the vaccine. But getting the disease is much more serious than getting the vaccine.
Absolutely. What is your recommendation for getting the flu vaccine this season?
Yeah, I would recommend that everyone who's eligible, which is everyone 6 months and older, does get it every year. Usually around October is the time that it's available. And that gives you time to have gotten it and to have time for your immune system to respond before the flu actually starts, usually a little bit later into the fall or winter when we actually start to see cases. But you want to have that protection on board before the cases start coming. That being said, if for whatever reason you didn't get it in the early fall, I would still recommend getting it at any point during the season. I mean, this year we saw flu into June, and so it was still around, it was still causing infections, and the vaccine would still protect you from that. And I would especially recommend flu vaccine for people who are at higher risk. So people who are over age 65 or who are pregnant or who have immune complications, because they are at much higher risk of having a serious outcome from their flu infection.
Right. So for this season, do we know what's the strain? Do we know kind of what the viruses are that we're going to be protected from with this flu vaccine?
Well, based on the World Health Organization's recommendations for this coming year, there'll be 2 strains of the A and 2 of the B. So an H1N1, an H3N2, and then the Victoria and the Yamagata lineage.
Okay. Wow. We talked about this in our other episode about immunization, but let's talk about side effects of the flu vaccine.
Well, side effects from the flu vaccine are extremely rare, but fever, muscle aches, those common side effects do usually occur in people who have not had an influenza vaccine in the past or have not had influenza. But because the virus is inactivated, like we said before, in all but the nasal spray version, it cannot cause respiratory symptoms. Again, the nasal version, since it is live attenuated, may cause some headache, low fever, sore throat, runny nose, mild congestion. But these only last for 1 to 2 days after the vaccine. And if you got influenza, it would most likely be more serious and last much longer.
Right. And Dr. Nedrud kind of touched on when the best time is to get the flu vaccine. You said October, but you also said really whenever you can is also a good time. Is that correct?
Yeah, and the other thing I didn't add is that for children under 8 who have never had the flu vaccine before, they actually need 2 doses their first year of getting it 1 month apart. And so thinking of that with your infants is that they should get their first vaccine and then a month later should come back to get their booster to provide them the full protection that they need.
Okay, thank you. So my next question is about where you can get the flu vaccine. Where would you recommend folks go?
Well, we have the flu vaccine at all of our NorthPoint sites, the main NorthPoint clinic at Penn and Plymouth, as well as the school-based clinics at North High, the Northside Teen Clinic, the clinic at PYC, Broadway, and the Heritage site. You can also get your flu vaccine. Some churches have flu fairs kind of, or flu vaccine fairs, I should say. And most pharmacies, including Cub, Walgreens, CVS, Target, and Walmart, usually provide flu vaccines for people. So we should be able to get them.
Absolutely. And let's talk about maybe those who should not get the flu vaccine. Who's recommended against that?
Yeah, if you've ever had a severe life-threatening allergy to a flu vaccine, meaning like your mouth swelled up and you were unable to breathe, you shouldn't get the flu vaccine. That's a very, very, very rare occurrence, but if that happens, talk to your healthcare provider. If you have an egg allergy, that's not a reason that you can't get the flu vaccine. You can absolutely still get it. It is safe, and we just observe you afterwards, the same as we observe everyone after vaccines. some people worry, oh, if I'm pregnant, maybe I shouldn't get it, but that's not true either. If you're pregnant, you're actually at higher risk to have complications from flu, and it causes miscarriage and problems with the baby. And so it is actually highly recommended when you're pregnant to get your flu vaccine. Some people worry about, if they're on blood clotting medicines, maybe they shouldn't get it. And that's not true either. You may need to work out the timing with your doctor based on when you take your medicines and when you get your shot, or hold pressure afterwards to make sure that you don't have any bleeding problems afterwards, but it's not a contraindication to getting the vaccine either. If you've had Guillain-Barré syndrome, which is a rare complication where your immune system attacks your nerves, and it can cause trouble with eating and breathing if it gets to that point. Previously, it causes problems with moving. If you've had that in the past, that may be a reason not to get it or to talk with your doctor. But often people who've had Guillain-Barré can still get the flu vaccine. There are people who shouldn't get the nasal flu vaccine. So if you, because like Kathy talked about earlier, I believe, the nasal flu vaccine is a live attenuated vaccine versus the injectable, which is a completely dead vaccine. And so if you are immunocompromised or have certain conditions, then we might not want you to, or you may not want to take on the extra risk of potentially developing the flu, from a mild version of the flu from the vaccine. And so then we would recommend the injectable version for you.
Thank you. And, we try to talk about this in each of our interviews for this show. We talk about social determinants of health. So can you explain how social determinants of health might affect who receives the flu vaccine and who doesn't?
Yeah, I think we see over and over and over again that racial and ethnic minorities experience higher rates of severe flu, influenza disease, and we also see over and over and over again that they have lower rates of vaccination. And I think there's lots of reasons that go into that. Some of it is access to care, some of it is mistrust because of mistreatment by the healthcare system. Some of it is any number of barriers, like transportation or financial, other things that go into that. And so I think our takeaway is that it's really, really, really important for those who are in these high-risk groups, who are racial or ethnic minorities, to get vaccinated, because they're much more likely to get the influenza and then to have a serious outcome when they do get it. Especially our African American or Black population and our Native American or Indigenous Alaskan population is those are the two highest at risk for having bad outcomes from flu and getting hospitalized and dying. And so really knowing that is, who lives in North Minneapolis and who we serve here, we really want to encourage you to get your vaccinations and to talk to us if you have concerns. We do want to answer all of your questions and make sure that you feel comfortable with this.
Absolutely. And we touched on this, I think earlier, but we talked about NorthPoint. We do offer the flu vaccine, so our information is there at the bottom. Maybe both of you can just give us your last minute thoughts on the flu vaccine and why you believe it's important that we get it.
I think the flu vaccine protects you, your children, and your community. So working together to promote health for all of us, I think, is really important, and I'd love to see you.
Yeah, and I do get it for myself every year. I get it for my kids every year. I feel very convinced about its safety, and I think even on the years it's not 100% effective, it is still partially effective. And having had a child in the hospital, that's not something you want. So, just anything you can do to reduce that, I think is definitely worth it.
Absolutely. Thank you. Mm-hmm. Well, those are all the questions I had. Thank you to Dr. Carrie Nedrud and Kathy Kreitzer, providers here at NorthPoint Health and Wellness Center, for talking to us about the flu vaccine. This has been very informational and important, so thank you.
Thank you for having us.
Thank you.
Absolutely. Thanks for your time. Thank you for listening to NorthPoint Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms.